Okay, and so there was even further reduction, as I said before, with brisker or very brisk type of walking. But what I also wanted to highlight here is this multivariant relative risk. And this is showing you that what they did is sometimes what we do with these studies is we also adjust for possible confounders to this. Could it be a time period that they lived in? Could it be menopausal status, parental history, alcohol, history of hypertension or cholesterol? Time, speed per walking. And one of the things you'll notice is after they adjusted for it, we saw that the reduction in risk was attenuated, which means it wasn't as great, but it was still pretty significant. I mean, we're still seeing about a 30%, 30%, 60% reduction in risk. And even when we adjusted an additional adjustment for BMI, in other words, those that were overweight, we still saw a reduction in risk with physical activity independent of that weight. It wasn't as great, but it was still a pretty significant reduction, which tells us that exercise alone has an independent effect on the treatment of type 2 diabetes and prevention of type 2 diabetes, even if the person does not change their weight. Okay, so this is how impactful exercise is in this particular standpoint, very similar to what we saw in cardiovascular disease. So what are some exercise recommendations that we really talk about here? We really would like them to do endurance, resistance, range of motion. Almost all of those are appropriate with diabetes. We want to do things that will expend greater than 2,000 calories per week if they're trying to do weight loss and primarily focus on aerobic. But still include resistance training programs. If you remember, resistance training doesn't have a significant impact on weight loss, but it does help to preserve those muscle tissues. It works with balance and coordination and all of those kind of things in strength. So people that do the resistance training along with aerobic tend to feel that they're able to accomplish more and do more, which is always good. But you have to consider their goals, their interests, their type, medication use, presence, and severity of possible complications as well within that. And this graph just kind of shows you what we see with exercise training adaptations as it relates to several of these different factors. So we have the cardiovascular endurance, in the ways in which it improves cardiovascular health in diabetic patients, what it does with skeletal muscle strength and endurance, flexibility, what it can be doing, and it's primarily focused on reducing injury, and that really helps with that, as well as exercise improves blood flow to help reduce the risk of peripheral neuropathy. And then, of course, better weight management and control of lipids, which can then further control blood glucose. So if I haven't convinced you yet already, I hope that you'll really consider exercise as an important part of life. It's not something that should be just, placed on the back burner. It's really something that should be the priority for the way in which it does that. The challenge that we've had with so many people is that we don't see the short-term cost as beneficial for the long-term benefit. In other words, many people see, I just don't have time yet. I'll have time later. But unless we make time for things, it just doesn't show up. And so this is a challenge for many people as it comes to lifestyle behavior change programs. So again, I've given you all some resources to review as it relates to some of these programs that have been shown to be highly effective in the prevention of type 2 diabetes. And also, just to reiterate, the use of other healthcare professionals, including public health professionals and exercise physiologists, either in your practices or being referring to them as these individuals are trained in the ability to help with these chronic diseases, particularly with clinical exercise physiologists. We are finding in the literature that exercise is extremely important for cardiovascular disease, diabetes, and cancer, the three big ones that we're kind of looking at here in this class, as well as for weight management. And they're trained and skilled in how to help people move forward in not only their clinical condition, in reducing that risk, but also in improving their overall health, and engaging and adhering to the lifestyle behavior changes. And again, if you are interested more in how to do that, how to create interventions to help people be successful, and how to improve individuals' adherence to these types of educational aspects, and learn a little bit more about health literacy, we have a class on health promotion and disease prevention in the fall that will be helpful in kind of building on some of these principles we've talked about here. So that's all I have for you on diabetes. If you have any questions, please let me know. Otherwise, have a great week.